Nahdha Hospital, one of the main hospitals in the Sultanate fighting against this colossal pandemic. With their PPE seen here, a frontline healthcare staff team of Nahdha Hospital dedicated for COVID-19 patients. These are doctors, nurses and other healthcare teams, all of whom work tirelessly to provide quality care for their patients 24 hours daily from the time they have initiated these specific services in the hospital.
Nahdha Hospital has been on the front line of a COVID-19 fight since February 2020. We started with one COVID ward, and now we have 3 COVID positive wards and 1 A&E special for COVID patients. We have been working hard during this Eid to help our patients. We know it has been a difficult Eid for both our staff as well as the patients. We want the relatives of the patients not to worry because we, Nahdha staff, were here to care for them.
Nahdha Hospital is one of the main hospital tasked with the great national cause of COVID-19 patients, beside other areas of hospital specialty of medical and surgical in ENT, ophthalmology, dermatology, oral maxillofacial, including internal medicine.
In Nahdha Hospital, we have 3 dedicated COVID wards, and most of the admission patients nowadays are more than 50% are elderly people with comorbidities. But comparing the seriousness of the illness to March and April, now the seriousness of the disease is less. But having said that, we should keep social distancing and hand washing is the must.
We are committed to do duty during the Eid, regardless of our personal circumstances. As everybody knows, most of all COVID patients is admitted in isolation ward. So we thought to support patients psychologically and celebrate the Eid with them, to be like one of their family member.
It's worth mentioning that the hospital management prepared to fight against this colossal pandemic as soon as the first corona case virus was detected. After mock drills and dry run for specialized treatment, the first ward of 20 beds and a high dependency beds were ready receiving COVID-19 positive cases.
Actually, we have been working in Eid without changing in our schedule. So we spent our time here in the hospital, and it has been a bit stressful time, but we are a bit committed to it, and we used to work in this stressful situation as well. So please, for us, stay at home, stay safe, and we hope this lockdown will get a good results soon, inshallah.
As a healthcare worker working during Eid and far from our family, so we understand the patient feelings that time. We consider them as our family. So as nurses, we are treating them emotionally and physically.
The hospital also had streamlined numerous processes such as isolated designated areas as well as emergency unit where whole sites specifically allocated to operate on screening process of suspected having the virus and treating positive patients. They have managed also to get additional staff from other areas to fully work in COVID wards. COVID-19 testing made available 24 hours with the results coming from the same hospital. Once again, the action was taken as soon as patients with COVID-19 continued to increase in the country. 2 more wards of total 48 beds each with specific high dependency beds were allocated all together. That makes a total of 68 beds, which are now 60% occupied by patients with coronavirus. This is the challenging phase for not only the country, but the whole humanity. We have seen how the number of COVID-19 increased in the Sultanate and how the frontline healthcare workers exert their efforts round the clock here in Nahdha Hospital and around healthcare institutions in the country. Their time will only be brightened when they see the whole community is behind them, sticking to the preventive measures of which will cut down the coronavirus. So be committed to the preventive measures, save lives and stay healthy. From Nahdha Hospital here in Rui, I'm Abdullah bin Ahmed al-Rubi'i, Sultanate of Oman Television.